For the rehab of patellofemoral pain, the focus is on strengthening the quads as well as the glutes. When specifically looking at the patellofemoral joint, we want to start with whatever compressive loads they're able to tolerate and then gradually increase those compressive loads as well. So this is an exercise progression to strengthen the quads and the glutes, as well as build up tolerance to compression at the patellofemoral joint. To begin loading the quads, we can start with a wall sit, which allows us the most control over how much compression at the knee we're loading into. So the more extended the leg is, the less compression we're going to have at the patellofemoral joint. As we go a little bit lower, that's going to increase the compressive loads at the knee. So initially you might start with somebody a little bit higher up in that extended position and work our way down, ideally holding somewhere between 30 to 60 seconds. The next progression is to add flexion and extension at the knee with an isotonic exercise. For majority of cases, they're probably able to start with isotonics as long as they're tolerated, and we can use a seated knee extension with an exercise band so somebody can perform it at home. Obviously, if they have access to it, then they can do a seated knee extension at the gym as well. And when they perform this, we just want to make sure that we're performing them nice and slow. So ideally, it's over a 3 to 4 second contraction with the concentric contraction, and then 3 to 4 seconds back with the eccentric contraction. The final progression is to add some load and some complexity, and we can use some lunge variations to do this. The first would be a reverse lunge. So when we perform the reverse lunge, it allows the shin to stay vertical. So as we take a step back, we're having less compression at the knee joint, and then coming back up. And then just performing a couple of reps here, again, trying to perform them slow and controlled. Once they're able to do this, then we can actually flip to a forward stepping lunge. Initially having a big step forward, again, trying to keep the shin relatively vertical, but then to add more compression at the knee, we actually want to take a smaller step so that the knee travels forward and we're adding compression. For the glutes, a glute bridge is a great place to start to work on hip extension. When we perform these, we want to make sure that we're getting full hip extension when we're performing these. For some people, that's a little bit challenging, so if we actually move our knees out and let them drop out just a little bit, it actually allows somebody to fully extend here, and it just has to do with the orientation of the hip in the hip joint. To progress the glute bridge, we can perform a single leg glute bridge. Everything remains just about the same, except obviously we're going to have one leg up. When we're in this top position, we want to make sure that the hips are parallel and that we're not letting the hip drop down towards the ground. So we're really focusing on that hip with extension as well as rotation. To strengthen hip abduction, a side-lying hip raise is a great exercise to start with. It's a modification of a side plank, so we want to have our elbow underneath our shoulder and our knees stacked. We also want to have our shins perpendicular to our body, so that way as we raise ourselves up, we can roll over the shin. So what it'll look like is we'll start here and then just slowly lift the hip up off the ground as high as we can go, and then back down to that original starting position. Again, when we perform these, we want to perform them slowly. So it's maybe a 3 to 4 second contraction up, and then 3 to 4 seconds back down to the ground. These can then be progressed to a lateral step using a mini loop, and the mini loop can be placed at our knees, at our ankles, or down at our feet, with each one of those progressions being a little bit more challenging. And so to perform, we want to have a little bit of knee bend. We'll take a step out to the side, and then slowly bring that following leg back towards that other foot. And so we want to make sure that with each step it's controlled. A lot of times with that back leg, they'll let it just whip back to that front leg. But we want to make sure that we're working both contractions, the concentric and eccentric contractions of both sides. So as somebody takes a step, they have to slowly bring that leg back to that starting position. And so we can just have them repeat just nice and slow from side to side, or if we want them to just go all in one direction, we can also do that as well.